Before we talk about individual artifact correction methods like frequency filtering or spatial filtering, we'd just like to make some general points about artifacts and artifact correction methods. I think they're even applicable to most data analysis methods, not just related to EEG and MEG. So first of all, let's start with a bit of classification of these artifacts. Artifacts can be non-physiological, that means from outside the body, whether it's brain or muscles, so just from outside anything from outside the body. So that could be noise intrinsic to the senses. You know, the EEG measurement, the MEG measurement has certain noise levels, even if there's no participant inside under the helmet. There's line noise in 50 hertz Europe or UK, 60 hertz in the US. In the MEG, there can be moving objects around the chamber, the shielded room, or vibrations of the building from slamming doors and stuff like that. And for that, there are methods like MEG filter that we will talk about in another session to remove artifacts from distant sources. Also, some MEG systems have sort of built-in artifact correction or suppression, if you like. We talked a little bit about the gradiometers in another session. You can also use frequency filtering if you think, for example, that noise is high frequency, or to remove line noise, or spatial filtering methods like signal space projection and independent component analysis. So these are methods that you can use if you think that artifacts have well-defined topographies. Then there are physiological artifacts that are still not from the brain. I mean, this could be eye movements or eye blinks and muscle activity. And usually we deal with them using spatial filtering methods, potentially also high pass and low pass filters. If you think that muscle artifacts are mostly high frequency, low pass filters might work. It's a bit of a dangerous strategy sometimes because they might be mostly high frequency, but not just high frequency. So you might still keep some artifacts. Anyway, just something to keep in mind. And finally, and that's a bit more of a complicated issue, they can be physiological, and from the brain. So that means there can be brain sources that you're not interested in and that are not included, for example, in your source model, but they might still contribute to your signal. Examples would be if you use a dipole model to model activity in auditory cortex or visual cortex, maybe with just one or two dipolar sources. But there's still the alpha rhythm, there's still resting state activity that you can't fully suppress. So this would, in this case, count as noise. And then you have to make sure that you choose appropriate source estimation methods and regularization, so that it doesn't spoil your results. There are some wisdoms that I would just like to get out of the way. Talking about this physiological noise from the brain, some people's signal is other people's noise. One example might be the alpha rhythm, which is usually a nuisance in my own experiments. When I look at event-related potentials for words or pictures, I don't want this kind of brain rhythm left in my baseline. So I don't want my participants to get drowsy and produce this 10 hertz rhythm, which is not really of interest to me. But for other people, that's exactly the meaning of their life. That's what they are studying. That's what they want to figure out. What does the alpha rhythm do? How is it related to attention, for example? So that's where you have to decide what is noise and what is signal for you. And unfortunately, it's not just something you can decide. So you have to understand your paradigm and how it's related to your brain data. And finally, it's always better to avoid artifacts than to correct them. Very easy to say, very hard to do. Often it's not possible to avoid artifacts. You can at least minimize them, like eye blinks, for example, give your subjects breaks, make them relaxed. Other artifacts might be a bit, more difficult to suppress. If you have to have a tram line somewhere close to your MEG laboratory, then these artifacts will be in your data, but hopefully methods like MEG filter can help with that. And other sources like the heartbeat are impossible to avoid, but then you have to ask yourself whether they are actually relevant or whether they actually are dangerous in your particular experiment or not. A bit more about that in a second. Why do we have to deal, or should we remove artifacts? It's quite obvious that they could be, they introduce variance into your data, but they could also be confounds. between conditions. So if they vary, for example, with task difficulty or between subject groups. But I also want to highlight that whatever you do, I mean, if you have artifacts in your data, they will also end up in source space. And an example for that is the eye blink, probably the most common artifact in EEG and MEG experiments, at least, well, I mean, not as common as the heartbeat, but probably more dangerous, I would say, because it can be systematically related to a stimulus difficulty, for example, and task demands. So here, if somebody blinks, and this is really just a single eye blink, you get a very nice MEG topographies, very symmetrical. So the retina is a dipole, so there's a voltage difference between the front and the back of the retina. And if you close your eyes, the current will flow. It's a bit like a short circuit. The current will flow, and it will produce this nice positivity here in the EEG centered around the eyes. But this current flow also produces a magnetic field, and this is reflected here in this dipolar topography. These are magnetometers. If you apply the right-hand rule, the current flows out of the scalp, so basically just above the nose. Right-hand rule means that the magnetic field goes around the current. It's outward, points outward here, so that's why it's red here. It points inward here, that's why it's blue here. So MEG is sensitive to eye movements and eye blinks. And if you then apply source estimation, we haven't talked about that yet, but if you use minimum norm estimation, which produces a current distribution that explains the data, it won't care where the data come from. You know, you might have created them randomly, or you might have, it might be an artifact, it might be real brain activity, but it will find a solution that fits the data. And in this case, it puts the source in the frontal lobe, possibly a bit of anterior temporal lobe, and they will be very symmetric. You can't really see that here, but it's not surprising because the EEG and MEG topographies are symmetric. So whatever you put in, now you will get something. You will get something out. That means there will be some sort of brain activity associated with it. So it's better to avoid that. And there are some claims that certain methods can deal with that and simply suppress or ignore artifacts. I think that cannot be true. I mean, everything that you measure in signal space, due to the non-uniqueness of the inverse problem that we will talk about later, it will somehow end up in source space. It might not produce a source distribution that you find plausible, but that's a different matter. Or it might produce sources somewhere where you might not be interested in. So if you're interested only in visual cortex or occipital cortex, you might not care about artifacts in the front. Fair enough. But in that case, you should also not interpret anything here as frontal activity. And I've definitely seen papers and posters where I thought, well, unless you've taken very good care of your data and your artifacts, I actually think these are eye blinks that you see there in your results. So how do we usually deal with artifacts like that? So all of these methods that we commonly use use some form of decomposition of your data. So that's why I'm going to spend just a little bit of time on that, just sort of to explain the concept. You can always decompose your signal, your data, in any way you want. So the question is just whether this kind of decomposition can separate the interesting bits from the not so interesting bits. So basically, if they can separate your noise and the signal. And there are different methods available to do that, but they all do very similar things. So first of all, you have to define a set of basis functions. So something that you think is useful to characterize your data. It could be sine and cosine waves in order to divide your data into different frequencies, or wavelets also in order to have different frequencies and times, or polynomials, more the higher order or lower order polynomials to remove drifts, for example, that can be useful. You can have data-driven methods that basically determine these basis functions from your data, like principal component analysis or independent component analysis, or in the time domain empirical modes. And if you have these, then you can fit these to your data so that they explain at least most of the variance in your data. So you then have a model for your data. And this model is basically based on this kind of decomposition into basis functions. And once you've done that, then you need some criterion to decide what is good and what is bad. So which of these basis functions reflect your signal of interest and which ones define noise. Might be just visual inspection or a priori knowledge, or maybe you have some independent criteria like You use EOG channels to determine eye blinks and things like that. And once you've decided what's noise, then you simply throw that away and you reconstruct your signal with the components of interest. And hopefully then you have clean signal. So that, of course, works if you've chosen your basis functions correctly, or if your ICA, for example, decomposed your data in a meaningful way. But if you don't get it right, then you might also either distort your data, or you might still have noise in your data, which might still be systematically related to whatever variable of interest you have. I mean, for example, eye blinks. You might have removed some of your eye blinks, but not all of them. So that there might still be this subtle difference between a difficult and an easy task, for example, that might produce a nice symmetrical activation in the front of the brain. So therefore, think carefully about what artifacts are the most relevant in your data. So maybe your experimental paradigm encourages people to blink a bit more or to move a bit more, maybe in some task more than another. So think about which artifacts you can expect. And then you can decide which method is best to remove them. So you should ask yourself about how frequent these artifacts are. You might just mark some bad data segments as bad and ignore them completely if artifacts only appear from time to time. You know, the occasional movement of your participant might not be very problematic, but if it's a systematic movement, you know, whenever they press a button or something like that, I mean, that could be more problematic. How large are these artifacts? So maybe you can, they are small enough. Do they have a particular time course and topography? So can you spot them in your data to actually check whether they are present or not? So inspect your raw data and see if there are eye blinks there, or if the heartbeat is visible or not. And finally, and maybe that's the most important one, are they actually related to your variables of interest? So you might, I mean, heartbeat is a good example. If I run my event-related potential analysis or event-related field analysis, I don't really care about the heartbeat because it'll probably be the same in all my conditions. It's not going to vary a lot with stimulus difficulty or task difficulty, although it might. But it will not be, I mean, the heart doesn't beat systematic stimulus presentation. So it will probably average out. And if I then do my contrasts, condition A versus condition B, I don't have to worry about it. If I run a resting state analysis and I want to compare old versus young participants or different patient groups with controls who may have different heart rates or body shapes or whatever might influence the signal transmission also from the heart to the MEG, then the heartbeat might be a problem. And I should probably use ICA and make sure it really works to remove heartbeat artifacts. The same is true with eye blinks. So some people just systematically blink whenever they press a button after they've seen a picture or word. In that case, make sure that you maybe look at latency ranges that are not affected by that you remove eye blinks from your data, use EOG channels to check whether people blink. So make sure that you've really looked at these things carefully. Okay, and now we will, in other sessions, talk a bit more about individual methods that you can use to correct for artifacts.